Now, I would like to, know, or rather, there are a few guests of mine. They were asking me that what is the cause of joint pain?
Now, as you know, we have big joints, small joints in our body, and we do look at them differently because we have to first diagnose we need to have the exact and precise diagnosis to go ahead with Ayurvedic treatment. Because we treat rheumatoid arthritis differently, we treat osteoarthritis differently, and there's also another cause which could be rise in the uric acid in the body.
Okay,
So that
okay,
also leads to something called as gouty arthritis. So that's a third kind of arthritis. So we have to
okay,
first understand what is the exact diagnosis of the patient. Otherwise, the treatment may go wrong, it may not work. And so I also heard you say that Ayurvedic treatment does not have side effects. Well, let me tell you that Ayurvedic treatment does not have side effects if you have diagnosed the case correctly and you have done
absolutely. Yes, yes,
pinpoint
yeah,
treatment. So that is
right.
called as Shuddha Chikitsa. Shuddha Chikitsa is the treatment that does not lead to side effects. Like when you're treating one disease, if your treatment is leading to another disease, which comes as a
Okay,
side effect, then it is not ethical treatment as per Ayurvedic scriptures. So there can be
absolutely.
side effects. I'll give you a tiny example. If a patient comes to you with heavy swelling in the knee joint, and
Okay,
the patient also complains of heaviness in the body, laziness, no desire to do anything. He just feels like just sitting and sleeping all day. He's not able to move at all. So, in this case, we have to get his C reactive protein checked first. Because if there is swelling in the entire body, if there is systemic swelling also in the body or inflammation, that could be the beginning of rheumatoid arthritis. Now, if we diagnose this patient as osteoarthritis or just start treating him directly with the Ayurvedic methodology like applying oils and giving medicines for osteoarthritis, then there could be side effects. Because
okay,
when there is swelling, if you don't treat the C-reactive protein first through Ayurvedic medicines and directly start applying oils, that could lead to increase in the pain and swelling and redness. So that is why here
okay,
it becomes extremely important. Ayurveda gives utmost importance to diagnosing the exact state and stage of the disease. And once you get
okay,
that right, it's like cracking an equation. When you put all the values correctly, you get the correct answer. So, rheumatoid arthritis, you cannot start off with Ayurvedic therapies immediately. So, if I have to give you an example, how we go about treating rheumatoid arthritis, it usually affects even your smallest joints. You could get swelling even in these, in your fingers. So, there's difficulty in moving. Sometimes they can also go, like this, crooked, and difficulty in straightening them up. This happens mostly in the mornings. So, in the mornings, the stiffness is the highest, and the
okay,
patient is unable to get out of the bed immediately.
uh-huh,
Okay.
okay,
So when you're treating this patient, you have to obtain his history first. His diet is
hmm,
definitely going to be inflammatory diet. Inflammatory diet
okay,
is heavy on milk, milk products, fish,
hmm,
non-vegetarian protein or carbohydrates, excess of carbohydrates in the diet, not following any dietary regulations or timings, not having any discipline with respect to the eating times, and sleeping late in the night, eating late in the night, day
okay,
sleep when you have
hmm,
your lunch and sleep immediately within half an hour.